Hey everyone, welcome to another episode of the 209 podcast. Last week, we spoke with some experts from UC Merced about the virology and the psychology behind COVID-19, the coronavirus pandemic that is sweeping the nation. This week, we're going to continue the discussion with Dr. Gokce Soydemir from Stanislaus State, who is an expert on the economics of the region. If this is your first time listening to the 209 podcast, you can find us on YouTube, all podcasting platforms, and of course, 209magazine.com, so go follow and subscribe. Now, without further ado, here's the conversation, and thank you for tuning in to the 209 podcast. Hello, everyone. Welcome to another episode of the 209 podcast. As I said in our last episode, there is currently a coronavirus pandemic causing the disease COVID-19 rampaging through our country, and we want to keep our listeners as informed as possible. This week, a stimulus package passed through the House of Representatives that is hopefully going to bring some aid to the country and to the Central Valley, the 209. And so here today, we have an expert from Stan State to talk to us about it. And Dr. Soydemir, could you introduce yourself to our listeners and just kind of explain the experience you have with economics?
Hi, I am Gokce Soydemir, the Foster Farms Endowed Chair of Business Economics here at Stan State. I have, in terms of forecasting experience, I have more than 20 years of forecasting here in California, Texas, and internationally. My research area is in applied econometrics, forecasting, and regional economics. And I've been here at Stan State for 9 years now.
Dr. Soydemir, you and I, we talk often about the economy here in the San Joaquin Valley and in the 209. And last time we spoke, we were talking about how the economy was slowing and, you know, how that could impact the future. What is the outlook now that the coronavirus pandemic has hit home? What are you predicting the Central Valley's economy to look like?
Well, I'm glad you actually mentioned our last report because indeed we were forecasting accelerated slowing here in the Valley economy. In fact, our GDP growth estimate for the second quarter was negative. And the pandemic obviously wasn't known then. Apparently, this had been going on since November, but it became public around late January. I'm not so sure. But these events obviously are extremely rare. In fact, in the finance literature, they're called black swan, because, again, to draw analogy from swans, because they're usually white, and once in a long while, a black swan comes up, and then it's a surprise. And that's what's been happening. So now we're updating our forecasts to take that into account. The GDP negative growth obviously is going to be more pronounced than it was before. The forecasts are for the nation are anywhere from for the first and second quarter combined from anywhere from 15% drop to a 30% drop, and that's nationwide. Now, if we factor that into our economy's unemployment rate is usually the structural unemployment rate we're talking about is usually twice the nation. So that would, let's say, 15% drop. So that would actually correspond to a 30% decline in the valley. So the impact would be more pronounced.
Right, and we see stores closing. Those that aren't essential. We see restaurants sending people home because they can only do takeout. How does that impact the economy here in the Valley? Just when the service industry goes under, how big of a chunk does that play in a local economy like ours that's, small and community based.
That's exactly true. Our economy, we have in our economy here, we have more unskilled to skilled workers. The ratio is much higher here in the valley than the nation. Around like 72% unskilled workers here of the entire workforce. So that constitutes sectors like retail, service sectors. Therefore, the will be feeling the impact much more heavily. The expectation is that this recession, which is officially, if you defined as two quarters of negative economic growth. So the expectation is either it's going to be V-shaped or U-shaped. But in our circumstance, the impact, if it's V-shaped or U-shaped, the impact will be much more stronger, and the recovery is expected to be relatively quicker, faster, nationwide. But because labor markets are not that well developed here in the valley, the recovery will be slower. So there's two impacts. We're going to feel a greater impact, and the recovery will be slower than the national average.
Yeah, and I wanted to ask you if the Valley will have maybe a leg up on other regions in the state, just because we do seemingly have a lot of what have been deemed essential workers. We have a lot of people who work in agriculture, producing food. Stanislaus County is one of the top agriculture producers in the country. We have a lot of healthcare workers. We have a lot of construction workers, and we have a lot of transportation workers. Those have all been deemed necessary. And of course, we have some news people working here too. But how do you think that's going to play in?
Well, the negative impact will be across the board. It's not going to be like the recession that, the Great Recession. Even the education and health sector, that category will be negatively impacted. Those offices that are not linked to coronavirus are shutting down. And then it's affecting, migrant workers are being limited in terms of collecting the produce. And then Port of Stockton, for example, imports a lot of bulk items, intermediate goods, and one of them that the big import item from there is liquid fertilizers. Given the interruption in the international economic activity, those things will be negatively affected. And obviously, that's going to have an impact on the farm industry. But what you're saying is also true. There's going to be, at the minimum, workers that are working in the essential areas to keep the goods flowing from the valley. So there are some areas where the impact is greater. There are other areas where the impact will be a little bit slower. But across the board, every sector, every category of employment will be affected by this.
Yeah, and has the country, or even the region around here, have we ever seen something like that where every sector, every person pretty much is affected by this?
Well, not in my lifetime, but Warren Buffett summarized it. I guess he's seen a lot more than we have. And he's saying that this is the first that he's experienced something like this in his lifetime. So definitely, and that's why the term black swan, right? It's a very, very extremely exceptional event that we're going through right now.
Yeah. Should people be worried, or do you see this, playing out and fixing itself, or do you see the stimulus package, reversing this and helping it out?
I mean, whenever there's uncertainty out there of this magnitude, obviously there's some worry. I mean, obviously, people are worried. They're losing their jobs. And not only that, everyone, I mean, working is in the family are losing their jobs. So the worry is inevitable. But fortunately, the government is stepping in and providing some relief. So that should help. It's important to note that, for example, in the Great Depression in the 1930s, one of the reasons why the depression lasted longer than it would have is because at that time central banks did not intervene, and so that was a lesson learned in history. And now the Federal Reserve and the government is acting quickly to not make that mistake again and minimize the impact.
Yeah, and can we look to countries that have gone through, hopefully, the worst of this already, like Italy and China? How did it impact their economy, do you know? And can we look at that to kind of help us get through this?
Well, Italy hasn't gone through the worst of it, but China definitely has, and China has well, posted there, announced that they're expecting a 42% decline in their GDP growth, and then they're also providing statements that the pandemic there is over. So if we take that at face value, how long has it taken? It's taken about maybe 3 months, 3.5 months. So if this thing, I mean, is going to peak, is expected to peak very soon, and the expectation is things should start get back to normal around May 3rd, May 2nd. So if that indeed takes place in the U.S., then the recovery should be quicker. And also there's the vaccine that's being found, and it's being administered on healthy humans. Human trials have started. And if that ends successfully, a vaccine will be ready for public distribution around August or September. So if we take those into account, definitely there's some worry, but that worry is going to dissipate, I think, come May and come August, and we will be back fully on track by the fourth quarter of this year.
Yeah, that's a good outlook to have. And like you said, people, are worried. They do want to get back to work, as President Trump has said. And he has thrown out the idea out there that we could be back to normal, or at least some things opening again by Easter. Do you deem this necessary to, quote unquote, save the economy?
Okay, so that's we have to be careful there. We don't want to have the experience of Hong Kong. Hong Kong thought that the pandemic was over, that everything was back under control, and they got complacent, and the virus resurfaced again. Now they're having to fight it again. They find themselves in the same situation they did when the virus first started to spread. It needs to be a well thought out decision. In my opinion, people come first. So we want to make sure that the peak is attained, and the pandemic is entirely over before opening up the economy, because lives come first. I mean, and without the people, I mean, there won't be any economy. So I guess that's a sacrifice. I mean, the trade-off between people aged over 60 versus the economy. So I'm not sure if that's a good trade-off. So I think it would be good to listen to the health experts and take their advice, and then decide whether to open up the economy in April or not, by Easter, that is.
So, from your standpoint, it sounds like you would definitely disagree with the people who are saying, it's either saving 2.5% of the population or saving the economy. You would say it's not that simple. Lives come first.
Exactly, and there's always the danger of the virus coming back. So if you open the economy up too early, and the virus comes back, then all these efforts will be gone. It'll be wasted. We might find ourselves in a more dire situation than we are now. So I don't think it's worth taking the chance with that. I mean, let's wait so that this is definitely um, gone as a pandemic, and then open up the economy. People are itching to get back to work. People are itching to get out there and resume their normal lives. So I think the recovery will be very quick. It's just a matter of this thing peaking, and then the vaccine being publicly available. And then I think that's a pretty short period of time. I mean, if you're back to normal by the fourth quarter, then things are going to start improving the third quarter. My expectation is in the second half. And then we should be in a pretty good shape. Usually, recessions last longer. So if we have a V-shaped recession, and then we know the source of this recession. If we didn't know the source of the recession, if there was more uncertainty related to that, then recessions usually last longer. But when the source is known, the impact is much shorter, negative impact, and the recessions are much shorter as well. And then obviously the stock market responds in terms of recovery and all that quicker when the source is known. So one thing about this recession is that we know the source, and then there's already a remedy out there. It's a matter of administering that vaccine, and then peaking. This virus peaking in here in the U.S. and then going down. So if all these things happen as expected, things should start improving from early May. So that's my expectation, and it would be worthwhile to wait another month, not to risk. And let's say if things go worse, if we were to open up in Meister, then we would probably be risking another 3 or 4 months. So I don't think the risk is worth it.
Right. And if things did get back to normal by the fourth quarter, as you predict, if everything goes according to plan, how would that compare to the Great Recession of 2008? How long did that last? And was it longer? Was it shorter?
The Great Recession was obviously very long lasting. This one here, that one was L-shaped. Here, the question is whether it's U-shaped or V-shaped. If you look at the indicators out there, there's going to be a very sharp decline, followed by a very speedy recovery.
Right. Once everyone is excited to go back out to the restaurants and everything, it should shoot right back up.
Exactly. I keep reading the social media that people are bored. They can't wait to go back out there. They miss their social environment. They miss going out there and shopping. So there's this impatience. Everybody's waiting for the good news that this is going to be over soon, and things will be back to normal.
Right.
Life will be back to normal.
Yes, we can hope, and we're making strides towards that normalcy. Today, March 27th, the House just passed the $2 trillion coronavirus stimulus package. I'm assuming you've had a chance to look at it and see what that includes.
Yes, obviously, it's not going to entirely alleviate the problem, but it's going to provide some relief. It's a step in the right direction. Banks are banks have to keep extending loans out there. That's very important. One of the things, the Great Recession lasted longer than one expected. Is because banks were not extending loans. And now with this relief package, banks will be able to extend loans. And then there's this 90-day wait period in terms of waiting for your to pay your mortgage. And then the $1,500 per person cash is gonna be good. Is gonna be a relief in terms of waiting until the pandemic is gone. It's not enough, but it's better than not having anything. So if you qualify per individual, per household, you're gonna get $1,500. So that's definitely a good thing in terms of minimizing the impact of the oncoming recession.
Right. Now,
and then interestingly, yeah, go ahead.
Oh, I was going to say it's actually $1,200 per individual and then $500 for each child.
Okay, but, so you're more up to date than me. Last time I read it was so. It keeps changing.
Yeah, no, everything keeps changing so rapidly. But I was going to ask you, how do you think that people should utilize that money that they're going to get from the government? I've heard that you shouldn't spend it on bills that, thanks to everyone being so understanding that you could possibly pay later. You should use it on things that you need right now. What's your thoughts on that?
Well, that's exactly true. I mean, your necessities, spend on necessities. Avoid things that obviously, just like you said, that you can spend later, and focus on purchasing food and supplies to get you through the pandemic.
Would you recommend people use it to maybe support local businesses, whether it be eating out or purchasing goods from them?
Absolutely. They're suffering, obviously, local businesses, and go support your local community, local businesses, so they can stay afloat as well.
Right. And there's relief in this package for larger corporations and smaller businesses, those that have 500 employees or less. Who do you think has been hit the hardest by this? Is it the small businesses, or is it those large corporations that we see are also getting aid?
Small businesses have been hit the hardest. Large businesses are relatively more prepared to avoid this kind of recession, but they're also obviously negatively impacted. But small businesses are more vulnerable.
Right, and it is an election year. We've seen candidates floating policy ideas that cost an upwards of $3 trillion, and everyone's asking, well, how will we pay for it? And now we see this $2 trillion package being, hopefully signed into law sometime today. Can we afford this? How are we going to afford this? Is probably what a lot of people are wondering.
Yeah, one step at a time. Indeed, we had record deficits before this happened, and then interest rates were already low. So we were running out of ammunition to fight a recession. The interest rates, Federal Reserve is down to zero, federal funds rate, and then the deficits were already at a record-breaking level, budget deficit. But now it's a very critical situation we're facing. If we did not provide more stimulus, fiscal stimulus, things will be much worse, and it'll take a longer time to come out of that hole than if we had stimulus. So this is not the time to think about that. First, let's get out of the recessionary period, and then once the economy is starting to expand again, then decrease that deficit gradually over time, so we can have these tools in our hands the next time something like this happens. I mean, I'm saying it's very rare, but recessions are part of business cycles. So whenever another recession, I don't know what another, for some other reason, when it occurs, we must have these tools in our hands to be able to fight it.
In the meantime, what strategies can small businesses adopt to weather through this storm?
Well, in our last report, our advice would be to, decrease your debt. So if you've done that, you're relatively in a better position. And then move into cash right now, cash. And because, accruals will increase, right? Arrears and all that. So you want to be in cash. And do work sharing, for example, to minimize the effect on unemployment. Maybe you can have some workers come work in the morning and others work in the afternoon, in terms of one working all day. So that psychologically that's going to help workers, because they'll still think they're employed and they'll get their jobs back when all this is over.
Right. And do you recommend that a small business utilize this stimulus package and take the government's assistance and take out a loan?
Well, absolutely. I mean, I don't think that's even, why wouldn't they? And I think they have no choice but to take the loan. So, the question doesn't even arise, because if they didn't, then they would go out of business. So the next best option is to take this loan. I don't think anybody, unless you're have a very financial strong enterprise there, which I don't think is the case, because the economy was already slowing for some time. You got to take out these loans. I can't, nobody will give any advice like go out there and don't take those loans. These are very attractive at very low interest rates. Not taking advantage of them would put you in a less competitive position after the recession is over.
Definitely. And I know even the federal government has offered to pay back some of those loans as far as, or as long as certain stipulations are met. Now, for people that are worried, we've talked a lot about worry during this episode. For people that are worried, what would you say to them to just reassure them as far as the economy goes?
Well, we've seen in China so far, not Italy, but China, it's peaked and the pandemic is over. They're going back to their normal lives in about 3.5 months. So the same thing, if we do it correctly here in the U.S., the same thing will happen. We should go back to our normal lives, start going back in about 3.5 months from when it started. And let's say that didn't happen. Well, the vaccine is in the works. That vaccine is going to come out to be publicly dispersed by August. So there's a lot of evidence out there to be very hopeful. And by the fourth quarter, things will start improving quite significantly, I think, in the second half of the year, of this year. And then in the fourth quarter, we're expecting a spike in GDP growth, latest, I would say.
Well, Dr. Soydemir, I think that message of hope is a perfect note to end this episode of the 209 podcast on. Hopefully everything you said comes true. And by the fourth quarter, we are, back in business. I want to thank you for joining us on this episode. Your expertise is always valued, as is all of the expertise of the experts over at Stanislaus State. Stay healthy, stay safe, and we appreciate it so much. Thank you.
Okay, Angelina, thank you for having me on. Always a pleasure to speak with you.
Absolutely. Thank you, Dr. Soydemir. Talk to you later.